Have you ever had the feeling that you're short of breath when walking, or that you're getting tired, or sometimes even when you're resting? Have you wondered if this is the heart or another cause? I'm Dr. Ricardo Freile, and today we're going to be talking about why you might be short of breath, how to know if the heart is responsible for this, and what diagnostic tests can help you find its cause. If you want to know this and many more interesting things, stay until the end of the video. Let's go! And to start talking about shortness of breath, the first thing is to define the medical term so that you know it. This is called dyspnea, or the perception of shortness of breath. And why is it important to understand this? Because perception is a sensation. It's not necessarily that you might be short of breath, and that's where I'm going with this. Because among the causes of dyspnea, or shortness of breath, are mainly heart problems, lung problems, anemia, muscle fatigue disorders, and finally, psychogenic ones, such as anxiety or panic attacks. And that's why I'm talking about perception, because in the latter one, some perceive that they're short of breath, when really, at an organic level, there isn't even a problem with oxygenation. And speaking of the cardiac part, the question is, why when the heart fails, do we start to feel that we're short of breath? And I'm going to explain it to you. You must remember that the heart has two main functions, contraction, or systole, and relaxation, or diastole. During this process, the heart functions as a pump, pulling or sucking, so to speak, blood, and then, after being oxygenated, expelling it. Remember that deoxygenated blood goes to the right side of the heart, and this pumps it to the lung to produce the gas exchange, taking out carbon dioxide and putting in oxygen. And then this blood passes to the left side of the heart and is expelled to the rest of the circulation to allow that oxygen to be carried for vital functions. When the heart fails in either of these two mechanisms, the normal passage of blood begins to be difficult. Let's go with that. There is an entity called heart failure. In other words, we're saying that this heart doesn't fulfill its normal functions. And this one here has two classifications, as it were. Heart failure with depressed strength, or heart failure with its strength preserved. And you might wonder, but if it has its normal strength, how can the heart be failing? And I'm going to explain that to you right now. When the heart, due to various causes, such as, for example, long-term hypertension, where the heart begins to thicken and then starts to fail, or, for instance, a heart attack, diabetes, chemotherapy drugs, and so on, this heart muscle can become scarred, and its muscle fibers can gradually be lost. What's going to happen over time? That heart will gradually become more and more dilated. And when it dilates, its strength to contract, that is, to perform systole, decreases, and that causes the ejection force to drop, which is why it's known as heart failure with reduced fraction. In these people, when they have that reduced strength, what is going to happen? Let's imagine that 1 litre reaches the heart. The heart should, in theory, pump out that entire litre. But when that muscle strength isn't at its best, it means 1 litre arrives and it pumps out, for example, 750 millilitres. In other words, 250 remain. And it's not that they just stay there in the heart, but they start to back up, because remember that another litre's coming, so there's no longer 1 litre, but 1 litre 250. I don't know if you follow me, but the important thing is that the bucket, so to speak, is filling up more and more. And that stagnant blood, or water, so to speak, where is it mainly going to stay? Since the left side can't pump everything, it pools in the lung, and in the lung it produces something called pulmonary edema, that is fluid inside the alveolar walls. And just a moment, are you finding the video interesting? Are you enjoying it? Don't forget to hit the subscribe button and the bell icon so you get notifications for the next videos I'll be uploading. The alveoli are the unit that allows that oxygen exchange I mentioned earlier, and those membranes must be thin. When that water gets in and causes edema, that is, increases the diameter, it becomes harder for the oxygen to pass through and oxygenate the blood. Therefore, pulmonary edema will cause poor oxygenation. And that's the reason why you start to feel like you're short of breath. And this becomes increasingly progressive. Why? Because at every moment as the days go by, more fluid accumulates if you don't do anything. Now, this fluid that's in the lung continues to pool, and as the days and months go by, it starts to pool in the right side of the heart. And the right side of the heart also starts to fill up, causing all the blood to back up, so to speak. Where to? To the whole venous system. Remember that the veins are what collect all the deoxygenated blood. So these veins will start to dilate, to widen, and the fluid will leak out through them. So the first veins to show that you're filling up with fluid are the jugular veins, which is known as jugular venous distension. Afterwards, the veins around the lungs start to swell, and that causes pleural effusion, or fluid around the lungs. If you keep going down to the abdomen, the liver, which collects all its venous blood, will start to swell, which is known as hepatomegaly. Then, the vena cava, which is collecting, and the portal vein, all the blood, they dilate and cause fluid to be released into the abdomen, producing something called ascites, a distended abdomen. And finally, the veins in the lower limbs, which bear the most gravity and can most easily dilate due to this phenomenon, are the ones we see most easily when the legs swell. That's why it's known that when your legs swell, you might think your heart is failing, although it's not the only cause. Now let's look at the other side. Why is it that if the heart, on the other hand, does have good strength, I can still be short of breath? It doesn't make sense. And the truth is, it does make sense, and I'm going to explain it to you. Let's imagine that your heart is very thick, for example, due to poorly controlled hypertension, and with a very thick heart muscle. So if the cavity should be this size, if there's a lot of muscle mass, that heart will have a much smaller cavity. Let's imagine the same example. 1 litre should fit in, but 1 litre doesn't fit because the cavity is very small. There's a lot of muscle mass in there. What's going to happen? Only 500 will fit. And where will the other 500 stay? The same in the lungs, making you short of breath, causing pulmonary edema, etc., etc. So that's known as heart failure with preserved ejection fraction, or strength. In fact, some also know it as diastolic heart failure. I mean, because that muscle has no trouble contracting, the problem is filling up. It's difficult for it. It's very hard. It's very stiff. Okay? So it's very important for you to know this because either of the two can cause shortness of breath. More commonly, the last one I mentioned is in older people, women, if you have many illnesses, lung problems, advanced diabetes, if you have many comorbidities or associated pathologies. And finally, how can you suspect the diagnosis of this? First, it will be clinical, with the symptoms, progressive shortness of breath, which you start to feel more and more with minimal activities, such as getting up, combing your hair, carrying small things. You can experience shortness of breath at rest, that is when lying down, and this is known as orthopnea. So what's happening here? Why is it that when you lie down you feel more breathless? Because when you move into this position, the blood pooled in the veins of our legs, which can be between 1.5 to 2 litres, moves faster to the lungs due to movement and gravity. And if I already have water in the lungs due to pulmonary edema, imagine, it's like the bucket's already full and I add more water. And that's why some people, when the cause of breathlessness is cardiac, can't tolerate lying flat and have to use pillows or they wake up during the night. You might hear them say, I go to sleep, doctor, but at 3 or 4 in the morning I wake up because I feel I can't breathe and I have to sit up and go to the window. And it's not because more air comes through the window, but because the moment they stand up, gravity pulls all that blood back down to the legs. And this is a characteristic sign known as paroxysmal nocturnal dyspnea, very typical of a cardiac condition. Tests to diagnose it. Initially, you can use something called atrial natriuretic peptide, which is a substance that rises when breathlessness has a cardiac cause. There are others, but it's a very good guide. A chest X-ray to check for pulmonary edema, pleural effusion, or fluid around the lungs, or to see if the heart is enlarged. And a very important test to have is an electrocardiogram along with an echocardiogram, which will give you that ejection fraction to see your status and if the chambers are large, thick, or not moving due to a heart attack. It'll provide much more information to help find the underlying cause that led to the heart failure. And that was our talk on shortness of breath due to cardiac causes. You might wonder, how do I know if it's pulmonary or due to anemia or other things? Leave a comment if you're interested, so I can make more videos, answer more questions, and help others. You can also help by hitting the like button. Press it now and sharing this video to inform others and reach more people. If you enjoy interesting heart-related topics like this, follow me on social media as Dr. Ricardo on TikTok and Instagram. And that's all. I won't take any more of your time. Don't forget that this is what your heart needs.